So a little while ago, I got an email from a student asking, Christina, how do I keep all of these signs and symptoms straight? Every disorder has different signs and symptoms. So how do I know if, say, the blood pressure increases or decreases, or if the heart rate goes up or down? Help! Friend, I totally get it. This is a huge struggle for nursing students, keeping all of these signs and symptoms straight for your med-surg classes, all those disorders you have to know. And so today I'm gonna walk you through the signs and symptoms of shock. Now let's dive in. Hey there, friend. My name is Christina Rofano from NursingSchoolOfSuccess.com, and here on the Nursing School Show, we give you the tips and the resources and strategies that you need to save time and raise your grades in nursing school. And today, we are talking about the signs and the symptoms of shock. And this one, girlfriend, is going to be a good one because I am actually going to start by telling you my one secret to acing med-surg exams when it comes to signs and symptoms. Are you ready? You need to learn the pathophysiology first before learning anything else. That's right. The pathophysiology of the disorder is the most important thing for you to know because everything else that you learn will stem from that. So let's walk through the signs and the symptoms of shock, and I will show you exactly what I mean. Now, of course, each type of shock will have its own set of specific signs and symptoms, but generally speaking, these general signs and symptoms here that we'll talk about may appear for most types of shock. The largest exception is a neurogenic shock, which tends to present quite differently than what we'll talk about here in this video. So I just wanted you to make a note of that before we get started. So here are the major signs and symptoms of shock that we will talk about: increased heart rate, an increased respiratory rate, decreased blood pressure, a thready pulse, decreased peripheral pulses, cyanosis, neurological symptoms like restlessness, anxiety, confusion, lethargy, or muscle weakness, a decrease in urine output, and absent bowel sounds. So, looking at this list, you might be getting really overwhelmed and wondering how in the world can you memorize all of those signs and symptoms? And here's where learning the pathophysiology first is super important, my friend. You don't have to memorize this list. Let's think about the pathophysiology of shock. What's really going on? So shock basically just means that there's a lack of blood flow to the organs, which can lead to organ failure. So this means there's reduced blood flow to the heart, to the lungs, the brain, the kidneys, and all of the other organs in the body, right? That's what it means. And now, knowing just that basic pathophysiology of shock and what's going on, let's take another look at this list of signs and symptoms again, and let's do some critical thinking about it. What do all of these signs and symptoms have in common? Well, they all have to do with a lack of blood flow. So the body always wants to stay in balance, right? So when the organs aren't getting enough blood, they are going to send signals to your brain that say, hello up there, I need some blood, please. And then the brain is going to send signals to the heart to pump faster and try to get more blood to the body. It's going to tell the lungs to breathe faster and get more oxygen flowing to the body. The blood pressure is going to drop because the heart isn't able to pump out as much blood as it was before. Does that make sense? Now the pulses will also be thready. The peripheral pulses will be diminished and cyanosis might occur because of that lack of blood flow to all those parts of the body. The patient may also have neurological symptoms, like we said, like restlessness, anxiety, confusion, lethargy, maybe muscle weakness, because the brain and the muscles aren't getting as much blood as they need. And if the brain isn't getting the blood that it needs, it's not happy, girlfriend. That's when all those signs and symptoms of mental status changes might happen. Decreased urine output and absent bowel sounds can also occur because there isn't enough blood going to the kidneys or to the GI tract, so they can't do their job either as well. So, all of those major signs and symptoms of shock are all connected to the underlying pathophysiology, that lack of blood flow to the organs and to the body. So how stinking cool is it that you can just learn the pathophysiology and bam, your amazing critical thinking skills can walk you through the rest of the things that you've got to know. You won't need to spend hours stressing about memorizing a whole long list of signs and symptoms. You'll already know them once you understand that underlying pathophysiology. Super awesome, right? And so those are the general signs and the symptoms of shock that you should really know for nursing school. They all have to do with the underlying pathophysiology, a lack of blood flow to the body, which can lead to organ failure. Now, fantastic job, girlfriend. And of course, if you want a deeper dive into shock, its pathophysiology, the nursing assessment you've got to do for it, and the nursing interventions, as well as some more signs and symptoms, you'll definitely want to dive into the NursingSOS membership community, where we've got all of those videos for you and a whole lot more. It's amazing. You are going to love it, and I'm super excited to see you in there. And of course, if you liked this video, let me know. Hit that like button, share it with a friend who might also need some help with the signs and symptoms of shock. And of course, make sure to subscribe and hit that little bell icon to be notified every time we post a new video. Thank you so much for watching, friend. I am so glad that you're here and that you want to become the best nurse you can be in a nursing school rock star. Now go become the nurse that God created only you to be. And I will see you right back here next time on the Nursing School Show. Take care.